Hello everyone. Today I will start with a small story. Many years ago, I had just started my practice as a consultant neurologist. And in the month of June, a couple came to me, a husband and wife, with a patient. The patient was his 86-year-old father. Their main concern was that he had started forgetting things. They had noticed this since a few months, but recently he had also started showing changes in behavior. Sometimes he would get aggressive, sometimes he would say weird things which he should not be saying. He remembered all his old things very perfectly, but he was forgetting that he had even had breakfast that day. And then sometimes he would get agitated. Sometimes he became a little aggressive and showed some very strange behavior traits. They were very proud of him actually, because very recently the government of India had announced an award for him for his contribution to the Indian freedom struggle, and on the next 26 January he was going to receive it in New Delhi from the hands of the president. So they were very excited and they wanted to go with him to New Delhi for receiving that award. And they were hoping that by that time he would have improved in his mental status and the forgetting that was happening to him and everything. So, and that was the reason why they had brought him to the clinic. We assessed him in detail for the memory loss. We screened him for dementia. My neuropsychologist did her psychometric evaluation on him. We ruled out the reversible causes of dementia. We found that he had moderate to severe frontotemporal type of dementia. That explained his behavior changes. I started him on medical treatment, and the neuropsychologist also advised them on tasks for brain activity. I gave him a month's medicines and I told them that they had to continue the medicines, do the tasks every day and come back for follow-up after 1 month. However, they did not do this, and suddenly after 4-5 months, the daughter-in-law came to my clinic in an extremely distressed state. She was almost in tears. She told me that they had started the medicines and they were doing the tasks, and after starting the medicines, he seemed to be doing very well for a few days. And that made them feel very relaxed and relieved. But however, after a month, they stopped the treatment. But over the past few months, he had worsened. He had episodes of very abnormal behavior. He used to suddenly take off his clothes. Sometimes he used to run out of the house. And for that reason, she had to start locking him up in his room. His episodes of abusive language and violent behavior had started increasing in frequency. What was happening perhaps once a month had now started happening almost every day. And both the son and the daughter-in-law were extremely anguished and distressed and frustrated. Obviously, the plan to go to Delhi had been shelved, had been cancelled, and I could even see that the respect and love that they felt for that person had started to fade away. All that had left behind was anguish and stress. They had started thinking that they had already lost their parent. This is what dementia can do to families. There are no patients of dementia. In India especially, where the family unit is still very tightly woven together, we have families with a patient of dementia. The caregiver burden is tremendous. This patient story, very early in my practice, taught me many lessons. And the most important lesson of them all was to have a session of family counseling as soon as the diagnosis of dementia is confirmed. And I have found till date in my practice that this is a very crucial step for goal setting of treatment and for the setting of realistic expectations in the caregivers. Dementia. Decrease in mentation. Mentation or higher intellectual activity is what defines us as people, as human beings. And here is this disease that strips us of that very quality which defines us as human beings. Dementia is a syndrome where there is deterioration in memory, difficulty or muddling up of thinking, difficulty in taking decisions, changes in behavior and changes in the ability of performing day-to-day activities, or what we call ADL, activities of daily life or living. Dementia appears mainly the older people, but it is not a part of normal aging. Sometimes it can start at an earlier age. With age, there is slowing down of most of our systems. Right from the skin and hair, things start changing. So why will the brain not change? So the brain does undergo some amount of slowing down of function as a part of normal aging. So this mild change in memory is called as age-related memory impairment. But age-related memory impairment is not dementia. There are main differences between age-related memory impairment, ARMI, and dementia. ARMI causes mild inconveniences, but they can easily be compensated by a few tricks of memory, such as making lists, writing a daily log, and so on. But dementia, however, cannot be compensated for a long time. It is chronic and progressive. Age-related memory impairment can be static and can stay like that for years and years and years together. But dementia progresses. So ARMI doesn't hamper daily life, but dementia quickly takes you to a place where your life is hampered. MRI of the brain in ARMI will not show many changes, but the MRI of a patient of dementia will show changes of a lot of brain shrinkage depending on the type of dementia, and in vascular dementia it will show changes of multiple areas of decreased or impaired blood circulation. In dementia, the person gradually becomes dependent on the caregiver for all the day-to-day activities. ADL is severely impaired as time goes on. The earlier we start treatment for dementia, the better. We have to do many things at the first visit. We have to do a quick assessment, we have to do a detailed assessment by neuropsychometry, and we have to differentiate from ARMI, of course. We have to rule out the reversible causes of dementia, mainly B12 deficiency and hypothyroidism, and we have to understand the severity of the disease. Managing a family with dementia is a multidisciplinary task. Neurologist and psychiatrist is just a starting point and is a focal point of treatment. We need, in addition, neuropsychologists, we need physiotherapists, we need speech and language therapists, we also need social workers. I usually do an extensive session of family counseling as soon as the diagnosis of dementia is done. I ask the caregivers to do one visit without the patient and all the reports in front of us. We do a session of goal setting of treatment, and we set the expectations of the caregivers in a very realistic way. So I feel that family counseling is an extremely essential step in managing dementia. We will be discussing these points in future videos. There are many types of dementias. The most popularly known type of dementia is Alzheimer's disease. The other common ones are frontotemporal dementia, vascular dementia, mixed dementia, and Lewy body dementia. Dementia occurs due to shrinkage of neurons. That means degeneration of neurons. This process of programmed cell death or apoptosis can start in different parts of the brain in different people. So each patient of dementia, to start with, is different from all other patients of dementia. It depends on which part of brain is shrinking in that patient. So if the memory sites have started shrinking in a patient, then that patient will present with short-term memory loss at the beginning. If in one particular patient the language areas have started shrinking, then that patient is going to start with something that looks like an aphasia. So these are primary progressive aphasias that later on start showing the other features of dementia. In Alzheimer's disease, there is progressive global slowing down. Whereas in frontotemporal dementia, there is predominantly behavior problems with disinhibited behavior. And this makes the caregiver's life extremely miserable and distressing. Remember that with carefully chosen medications, we can now control a lot of features of these behavior change. Managing dementia is not just skill, it is also art. We can control a lot of these psychotic features, the hallucinations, the delusions, the aggression, the irrational behavior. We can control many of these. Our goal of treatment is to keep the patient dignified as long as possible, to keep the patient comfortable, and to keep the patient manageable. Dignified, comfortable, and manageable. And the caregiver of the patient is also on our radar of treatment. That is the concept of the family with dementia. So, as we have seen, there is a lot to be shared about dementia. We will be sharing all these different aspects in my future videos. I also have a parallelly running blog on this, which you can find in the link below. Please click the link to subscribe to the channel so that you will be notified whenever my next video is uploaded. My podcast is also available in Spotify and Anchor. And do stay tuned. We have a lot of information to share together so that we become aware of what the problems are and so that we can be mindful about the way we manage our life. Signing off, I am Dr. Purnima, a neurologist by profession, passionate about emotional fitness, neurorehabilitation, palliative care in neurology. I am the MD of our social profit company, Niche Advocacy Foundation, and the proprietor of Purnima Gauri Neuro Center.